Thank you for visiting my website. My name is Edith Fleck and I've created this short video just to give you some insight into the areas that I work in and what I'm trained to work with. My background is nursing and I began my nurse training as a basic general nurse and got an opportunity later on when my children are older to upgrade my nursing. That led me on to nurse management, which equipped me to manage units and facilities. During this time as a young nurse manager, I could have been managing up to 60 staff. And as you can imagine, that would be very overwhelming for any young person. So I felt that I really needed some skills and some tools to help me manage the many difficult situations that I was faced with on a day-to-day basis. So I undertook my first diploma in counselling at the University of Ulster. That indeed did give me some skills and tools to help relatives and patients alike. So if you could imagine someone placing a relative in care who had dementia, and I think we would agree that that would be a very overwhelming thing indeed. And this training equipped me to get alongside relatives and patients alike in a different way. And it gave me insight into their feelings and emotions that they were having at that particular time. Later on, when my children were older, I got an opportunity to go back to university. And I undertook postgraduate training in CBT, postgraduate training in couples, postgraduate training in systemic and family therapy, and I was awarded a commendation from Queen's University. Why do this extensive training? Well, I firmly believe that it is not a one-size-fits-all when people come to counselling. And when people come to counselling, often they present with many and varied difficulties. So the extensive training allows me the opportunity to explore fully and assist that client in a collaborative way without them moving on to another counsellor who does a speciality that I may not have. So for instance, if someone was coming to me as a couple and they were presenting with depression or anxiety, then I'm equipped to deal with that without moving them on to someone who has CBT experience. What kind of people do I work with? Well, I work with children, I work with couples, I work with families, and I work with individuals. I can assure you of a warm, calm environment when you come to counselling and assure you of confidentiality. So coming to counselling is indeed overwhelming and it is probably one of the most difficult decisions that you will ever make in your life. And I imagine if I was coming to counselling, I would indeed be feeling the same way. So it is important that you're assured of my professionalism and that you're assured that I am genuinely equipped and willing to help you. Throughout our journey, this may mean change. Often change is difficult and often that requires us to work hard together, doing homeworks and making sure you get the best out of counselling. But sometimes, unfortunately, it also means that change isn't always easy because change sometimes depends on the other person. Therefore, counselling can be difficult for the client who is coming, and perhaps it is about acceptance, walking with you in your journey of pain to help you accept the situation that you find yourself in. Whatever the situation and whatever the problem, I assure you of a confidential and safe setting where we can explore and find strategies to help you manage your difficulties in a different way. I look forward to working with you.